Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for having us this morning.
Well, thank you for having me on the program again.
Okay, Minister, let's jump right into it. I know yesterday we would have commenced the vaccination process of persons 60 years and above. Can you provide us with an update on how the response to that across the regions?
I think the response has been tremendous. There have been a few teething problems. I think people did not know where to go, and we are sorting those out, but the response has been great. People have been coming out, getting their vaccines, and the process we've been observing people and to make sure that after they receive their vaccines, we observe them for 15 minutes just to make sure that they're okay, and then they go. But I'm extremely pleased with the response that we have gotten so far, and I would encourage everyone to please ensure that they come out and get their vaccines. The reason, as you know, why we are targeting people who are over 60 is that we have seen from our statistics that the older persons are more at risk for COVID-19, and unfortunately, many of the persons who have died so far of COVID-19 are really older persons. So, as has been shown around the world, if you are immunized, it protects you from getting the more severe form of the disease, and therefore it would protect our elderly population. So we are extremely pleased to be able to offer this vaccine to persons 60 years and above.
Okay. Additionally, Minister, we saw former President Donald Ramotar and Prime Minister Brigadier Retired Mark Phillips taking their vaccine yesterday. Has there been any response from other government officials or members of Parliament who indicated that they wanted to take the vaccine?
Actually, it's not only President Ramotar who took his vaccines, but you have former President Samuel Hines as well, and former President David Granger, who took the vaccine. We have also been talking to the Parliament, and we are making arrangements to ensure that MPs who would like to have their vaccines in this round, that we are able to give the vaccines to them. And I'm sure over the next week or so, different members of the Cabinet would also be taking their vaccines.
Okay, Minister, I have to ask, and I know you've said that you will take it when the time is right, but have you considered taking it in this round?
I'm still thinking about it, but I think the most important thing is to make sure that people get their vaccines, and that's what I'm working on. I'll eventually get mine. I really don't have any hesitation to take it. And having worked in this field for many years, it's not really an issue, but I would prefer that, you know, we do all the things to make sure that we can get people their vaccines as quickly as possible, and that is what my focus has been on. But at the right time, I will certainly take mine. It's really not an issue for me.
Thank you for that, Minister. Now, before we move on from that, I know we've begun the process of immunizing our healthcare workers. Can you say to date how many of them have been immunized?
I don't have an exact number, but you'll recall we started immunizing healthcare workers using the 3,000 doses that we received from Barbados. So we have been able to spread that around to the people who have been dealing directly with COVID patients. So in every region, we have actually been able to immunize healthcare workers. And during this round, we have allocated another set of vaccines to be able to mop up those who did not get. We estimate that there are about 12,000 healthcare workers in both private and public sector. And we have allocated, in a sense, vaccines to cover this group. And so we have send those doses out to the different regions, and we are inoculating. And at the same time, we've also looked at the elderly populations in these regions, and again, we have allocated accordingly. So hopefully we can get more people getting their vaccines as quickly as possible.
And with this current current rollout, this current batch, we would see most, if not all, the healthcare workers being vaccinated?
Once they come forward, as you know, it's a voluntary process. So once they come forward, they'll get their vaccines. If, however, they delay too long, then maybe the other categories of people would then take the vaccines because, as you can see, we really have a demand from the 60 and above population to get their vaccines. So if there's too much of a delay from the healthcare workers, we would just move on to the people who are coming forward to get the vaccines.
Okay, understood. Continuing on vaccines, Minister, the Sinopharm vaccine is not yet on the WHO's emergency listing. And there have been quite a few questions to taking this particular vaccine. Many persons are asking if it's safe and what does it mean by an inactive vaccine?
So a couple of things there. There are only two vaccines that the WHO has authorized. It's the Pfizer vaccine and AstraZeneca vaccine. So there are only two. In the United States, based on their needs, they have authorized Pfizer, they have authorized Moderna, they have authorized Johnson & Johnson. In other countries, different countries have authorized different sets of vaccines. So countries now are looking at the safety, the efficacy of the vaccines, and based on these parameters are giving a go-ahead to use them. We in Guyana, we have analyzed the vaccines that are currently available, and we have looked at the safety profile of the Sinopharm vaccine, and it is really safe. Its efficacy is 79.4%, and which means that it prevents infection, a large percentage of infection. In terms of the AstraZeneca, you would recall that when it first came out, the 2 full doses, the efficacy was 62%. But when you increase the interval between administration of the doses from first dose to second dose, if you increase that to about 8 to 12 weeks, then you can see the efficacy goes up to about 82%. So the vaccines that are currently available, they work. And that's what we want people to understand. Sinopharm is safe. Sinopharm is right now listed by the WHO in what is called an emergency use listing, pending the full consultation and going through a process. But they're listed on the website. The other vaccines that are listed are Sputnik V, that is also listed. But the WHO has a timetable by which time they collect this information, then they have an expert panel that would go through the information, make some recommendation to the WHO, and then the WHO would approve. So these vaccines are all in line, waiting for that approval. They have submitted all the dossier, all the paperwork that is required to the WHO, and they're now awaiting the approval. And that's where it is right now. But there are countries that are already using Sinopharm. So Sinopharm has been given emergency use authorization in China. It has been widely used in the Middle East. There are a number of countries in South America that is using it, Brazil, Argentina, and a number of other countries who have used it. In Mexico, just yesterday, the president and that country has ordered 22 million doses from China because they need vaccines for their population. So many countries around the world are using these vaccines to make sure that they can immunize their population.
Okay, so just taking it back a little bit, so the side effects would be similar to
They're
AstraZeneca?
similar. These vaccines are made in some very traditional ways, right? And we have been making vaccines like this for the last 100 years. So we know how, these companies know how to make these vaccines using these methods. This time around, they have applied a new method, but only for the Pfizer and the Moderna vaccine. So that's new. And we have never used this method to develop vaccines. And so it's the first time those types of methods are used on a human population. But all these other ways, the way that Sinopharm was made, these have been traditional things that have been used for the last 100 years. The way the AstraZeneca vaccine has been made, this has been used, again, for many, many decades. So the technology, the companies that are making these things are very au fait with the technology. You tweak it to suit whatever the epidemic, the types of virus that you're going after. You have to tweak it to make sure that you're able to do that. And that's what these vaccines, these makers of these vaccines have been able to do. So they're very safe. And we generally know the side effects that you'll get from them. All of these vaccines, basically the side effects has been what you call reactogenic side effects, meaning your body would react when you get an injection. So if you get an injection wherever the site of the injection, some people would experience pain afterwards. Some people might get a headache. Some people might get fever. And others might not have anything, right? It's just how your body reacts to these vaccines. And for most of these vaccines, that's the type of reaction that you will get. And within a 24-hour period, that's it. You don't get back anything, right? There are, however, the possibility, very rare possibility, of what is sometimes called an adverse event. And so out of abundance of caution, one of the things that we have been doing is that after somebody has been administered their vaccine, we will observe them for 15 minutes. Just out of abundance of caution. We don't expect anything, but just to make sure. Because if they develop any allergic reaction to the vaccine, it should occur within this 15 minutes period. And if it does, then we are able to take the necessary action to prevent it from escalating. So that's what we've been doing. And it's really safe because millions of people have already used these vaccines. Millions around the world have already used these vaccines, and there's nothing that has been reported in the scientific literature to say that if you use this vaccine, this is really bad. We would have seen that all over the place. You're not seeing that. And in fact, right now, the demand for these vaccines are so great that it's very hard to access vaccines globally right now because the demand is so great. Everybody wants vaccines now because everybody realized that this is the only way that we'll be able to exit the pandemic. And so there's a real great demand to access vaccines.
Okay, thank you so much for that, Minister. Now I'll be handing you over to Ms. Tamika Rotney from HGP Nightly News.
All right, Minister. Thank you so much, Amara. Today is a very important day in the history of COVID-19 outbreak in Guyana. It actually marks 1 year since the first case was identified, case and fatality that is. And so, Minister, I would like to ask a few questions on, how far we've come and where we're headed. Are you satisfied with the COVID-19 response so far, since you would have attained office? And what is the way forward for Guyana as it relates to COVID-19?
So thank you very much for that. I think, looking back over the year, that we have actually made a lot of progress. When this pandemic first started in December last year, and we got our first case, at least identify our first case on the 11th of March, it was the same day that the WHO had actually declared COVID-19 as a global pandemic. So that day in itself marks a recognition of how this disease was spreading and the kinds of challenges that it would pose. Initially, we were unprepared to be able to deal with COVID because that first patient that came into to the hospital our health system, it took a while before we actually recognized that this person had COVID. And after that, we start trying to put mechanisms in place. Unfortunately, that first patient died, and then at the same time, a lot of our healthcare workers who were exposed, about 30 of them or more, had to go into quarantine to be able to be monitored to make sure that they didn't have COVID. We then start trying to put things in place, but it took a while before we can actually build our response. When we took over in August, there were lots of things that still needed to be done, including testing. We weren't testing enough, and if you weren't testing enough, then you really can't understand the magnitude of the pandemic in the country. And so one of our priorities has been to increase the level of testing. So we have improved the capacity at the National Public Health Reference Lab. That capacity now, we are capable of probably doing about 2,000 tests per day. We have automated the systems so that the turnaround time is faster, moving maybe from an 8-hour for 96 tests to less than 2 hours. We have included other things. We have bought point-of-care testing machines that we are now putting at the regional hospitals. And of course, we have antigen tests that you can get back those results within a 20-30 minutes period. So the whole testing environment has improved drastically. And we have moved from where there was no private entity offering testing to now having private entities that can offer PCR testing. You now have Eureka medical laboratories that came on board. And just recently, we had another laboratory that was granted provisional licensing for PCR testing, and that is Coastal Diagnostics, because they have met the requirement for PCR testing. So we have improved the testing environment, and more recently as well, we have accredited, I think, about 8 other sites to be able to do antigen testing. So testing has improved. We have looked at also building the hospital capacity to be able to manage COVID-19 patients. And we have improved the regional hospitals by adding beds, adding ventilators, oxygen concentrators. These are all things that are necessary to manage the acute respiratory distress that patients would experience. And so we've been able to do that. We had looked at treatment modules, how to treat patients more effectively. We start doing convalescent plasma. We have also introduced other medications such as remdesivir and so forth to assist patients. So in terms of treatment, we had improved that as well. And then we looked at how can we expand our ICU capacity. So by bringing on board the infectious disease hospital, we extended our capacity to be able to isolate patients, but at the same time, we also improved the ICU capacity. So we now have 25 ICU beds where we can monitor and treat patients. And over time, we have been building out the capacity there, putting in more ventilators, putting in monitors and so forth, so we can improve the service. Staffing, people trained to do this, having specialized skills such as intensivists and so forth. We've been able to hire some of these people, bring them into the country and get them to work with our staff. And just 2 days ago, we were updating our treatment protocols to ensure that doctors across the country would be using the same protocols to treat COVID-19 patients. So from a medical response, I think we have gone leaps and bounds in terms of what we're doing to manage COVID patients. We also looked at some of the societal response. trying to get people to be more compliant with mask wearing and keeping social distancing and so forth. And while we would have had some success, I think, with mask wearing, I think most people abide by wearing their mask. We still see others who are using the mask inappropriately, so they have it on their face, but they're not covering their nose and mouth. And that's a way that you can get infected. And in some institutions, they would abide by reducing the crowding in the facility, but in others, they allow too many people to be there. So we still have to work to make sure that people are understanding that COVID-19 is still here, and people are going to get infected. People are going to, get sick if we don't abide by these rules. So that's an area that we have to keep working and reminding people, about the way that this disease is transmitted and how you can get infected. On the social side, the government has been able to give out the COVID-19 grants to assist family, and we have opened up some of the work sites so that people can go back to their jobs, and so they're able to earn a living. You would realize that just recently a report was done by UNDP that pointed out the economic situation of households and how COVID-19 has impacted on households. And therefore, you have to strike a balance between lives and livelihood so that people can be able to earn a little bit of money to make sure that they can survive through the pandemic as well. So I would say that overall, we have ramped up the response in various ways. And by and large, I think today we are much more wiser about COVID-19 than we were 1 year ago. And I think people are more informed. What we have to do now, and it's still a challenge, is to use the information that we know and turn that into behavioral change. Because the same persons who are not wearing the mask properly, if you talk to them, they actually know what is the right thing to do. So to make sure that people do the right thing. And I guess we have to, keep belaboring the point. The other important thing is that 1 year on from this pandemic, we now have vaccines that are available. Those vaccines first became available in December last year, and we have been able to access vaccines this year, and we have started to roll out these vaccines. So this whole promise for the future, because with vaccines, once we immunize our population, we'll be able to arrive at herd immunity, which means that for the virus to transmit within this population, it would be much more difficult once people are immunized. And we are hoping to do that. As we immunize people, we would be able to go back to some level of normalcy. And then once we meet that level of herd immunity, then we can actually bring an epidemiological end to the disease. But we have to keep working on immunization. And once we do that and immunize most of our population, I think we will be in a better position.
With more vaccines rolling in, we would have received from India, China, and there's more from COVAX that are expected to come. Do you see herd immunity, us achieving herd immunity at an earlier stage?
Once we have access to enough vaccines, we have a plan of how to roll it out. But again, the big question really is how much we can get and how fast we can get it. Because as you can imagine, this is a global problem. Every country right now is trying to access vaccine. Every single country. Because we're all going after the same things. We all want the same things, right? And that is the challenge. So once we can get enough vaccines coming into Guyana, we would roll that out. As fast as we get them, we can roll it out. We have been able to really ramp up our cold chain storage, training a lot of people to be able to immunize persons and so forth. So that aspect we have prepared for, but getting in the material, that is what is important. As you rightly said, we have the 20,000 from Sinopharm as a donation from the Chinese government. We have 80,000 from the Indian government, AstraZeneca vaccines, and we're expecting 100,800 doses from COVAX as a first tranche. And we are working with them to get the dates when those are going to come in. And we have been looking at other bilateral arrangements to bring in additional vaccines. So we'll keep working because we really want to immunize as many people as possible. And just to clear up one little fallacy that people might have, and that is some people have been asking me about why we're not immunizing children. And we're not immunizing children because none of these vaccines have been recommended for children. They're all for adults 18 years and above. So that's the reason why we're not immunizing children.
Last two questions. A lot of persons, or there have been calls for you as Minister of Health to take the vaccine. And I know you mentioned earlier that at the right time, but persons need to know, or a person would like to know, when exactly do you intend to take the vaccine? They see it as a way of, you should have been the first to take the vaccine and lead by example. But let's hear your take on.
No, my answer is simple. It's the same one that I've been saying all the time. I really, I think other people are more vulnerable than I am, and I would prefer them to get the vaccine. That's really my simple answer. It's not that I have any hesitancy or anything of the sort, and that's what I'm saying. I prefer somebody who's more vulnerable than I am. While I interact with people, I am not at such high risk for COVID, and I really have changed my behavior in terms of interaction and so forth to minimize those risks, right? So I think persons who are more vulnerable, and I truly believe that older people are more vulnerable, persons with comorbidities and so are more vulnerable because we have seen the statistics. People with comorbidities such as diabetes and cardiovascular diseases and so, they are more vulnerable, they are higher risk, and therefore I think they should get the first opportunity. But if my taking it is going to instill public confidence, I'll do it. So I'll let you know.
Thank you so much for that, Tamika, and thank you so much for your time today, Minister. This has been our COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.